Mike, my question for you is, how do I know my insurance will cover my visit, or will they cover my visit?
Yes, and we get this one a lot as well. That's why it's a frequently asked question, I guess.
Hmm.
And this one is tricky, but I'm glad that you asked it because we are in network with a lot of different insurance companies. And for the vast majority of those insurance companies, they will cover 100% of your initial visit and some portion, if not all, of the x rays that come along with that visit. However, that's not true for every insurance company. So we do tell patients that, hey, we want to get an idea of what insurance that you have before you come to the office. We ask for a couple of three pieces of information. Typically, it's a birthday, it's the name of your insurance provider, and then some personal identification information, whether that's a member ID number or a social, just so that we can communicate with your insurance company and get all of the details. Now, we haven't had an issue in the past with just kind of guessing because that's not our policy. So what we do is we literally call insurance companies that or get onto their websites for every patient that we've got coming into the office and print out
Hmm.
your unique plan for you. That way,
Hmm.
we'll know if your insurance does cover that first visit or not. And then if they don't, we'll be able to tell you exactly how much it may cost before you come into the office. One of the things we really pride ourselves on is letting you guys know how much things are going to cost before we do them.
Yeah.
Because, Edith, I don't know if you've been in a situation before at a medical provider's office, you just need to have something done, you find out what it costs later. That can be kind of
Fortunately, that's never happened, but I know that I would not be happy with that. So, we try our best to treat you guys the same way that.
exactly. And, I'll be honest, we do make mistakes from time to time, but
Hmm.
Katrina and myself, we're the two who work up front, and it's literally our job to communicate with these insurance companies and to know them front to back, so that we can be your advocates for our patients and make sure that you guys are well taken care of, and
Yeah.
and so that we can maximize the quality and the use of your insurance benefits too. So if you ever have any questions, just feel free to ask.
And I think it's cool that we have the option for you guys to check ahead of time before the patient even walks in the door. So that's awesome. But then that's also why we have that little window of coming in early. That way we can get some things figured out prior to your appointment. You don't have to feel rushed or anything. We can take it step by step.
That's true. Yeah, and I probably should have threw that into that first answer. That's a good point. Thanks, Edith.
Yeah. 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 Okay. Perfect. Okay. What do
All
you
right,
have for me?
back to you, ma'am.